My name is Dr. Joe Francis. I'm a physician in the Department of Veterans Affairs. I also direct the Office of Clinical Analytics and Reporting in the Office of Analytics and Business Intelligence. Part of what I do is direct a very talented team, a multidisciplinary team that exploits the assets of our electronic health record and our very rich administrative data to try to improve healthcare and to give actionable information to clinicians and managers. The reason I got into this role, I didn't start out thinking that I would do this. In fact, when I started out, there wasn't even an electronic health record in existence. But I was trained as a health services researcher and a clinical epidemiologist, as well as a clinician. I had a real interest in seeing how data could improve clinical care, how data given into the hands of clinicians and managers could improve the decisions that they make for patients and for health systems. And it's been an exciting journey because of the wealth of information that we have in VA and the many opportunities in the healthcare landscape to make a difference. There's a lot of work to do in healthcare to improve value, to reduce waste, and to improve the experience for patients. My office is very much focused on measuring the health care performance, including quality within our system. And I think that journey really goes back to the mid-1990s when VA began its first transformation under Dr. Ken Kaiser. We started for the very first time providing feedback to clinicians and to teams and to facility leadership about our quality performance. And on many indicators, we were sadly lagging. Maybe 25% of our veterans were receiving the types of preventive measures or the types of medications that were indicated based on their condition. Very quickly, just with the feedback of that information, we got that level of performance up into the 80%, 90% range, well ahead of the rest of the country, which is, again, a wonderful illustration of the power of data. And I think that has translated, frankly, into thousands of lives saved, made better, because folks are getting evidence-based treatments. They're getting flu shots, pneumonia shots, hepatitis vaccine, and the kind of medication that we know from scientific study can make a difference in their outcome. And without analytics, without the feedback of data and the ability of clinical staff to act on that information, we couldn't have made that change. It's made VA the strong health system that it is today. We're about to embark on another transformation of VA, focusing on improving access to services so that more veterans can obtain the kind of care that the veterans to date have received. And we're going to need all of our analytic skills to improve our capacity and to understand where we have bottlenecks, where we can actually be more efficient in how we see patients, and where, frankly, we can start giving data directly to the patients themselves so they can better manage their own care. We use numbers because we have to change the behavior of patients and the behavior of providers. We know that we are not always as fast as we should be with implementing what the latest science tells us we should be doing. We know that there are practices that we have that we should have stopped doing years ago. And to stop doing low-value activities, we need feedback. We need numbers. Finally, I'm also very excited about the possibility that very soon patients will have as many numbers about the quality of our care as we do. And so we have to understand the kind of data that they're looking at because by providing numbers to patients, making it as accessible as checking your own banking account balance, we can drive patients to better behaviors that improve their own health. I think the most important thing to understand with analytics is that it's an organization-wide resource. The biggest mistake is that you delegate the analysis of numbers to an office or to an individual. It needs to be a participatory sport. These numbers only make sense if clinicians and managers in the front line are able to look at their performance, turn around and see what's actually happening in the clinic, understand the context of the numbers and how the numbers are generated, and make the appropriate adjustments. The numbers themselves don't have any meaning. They only have meaning to the extent that people that are actually delivering clinical care, and all of us, whether we're doctors and nurses or therapists or even scheduling staff and frontline managers, we're involved in the care delivery process. We have to understand what those numbers mean, look the veteran in the eye, look at what's happening in our clinics, and take those insights to make a difference. So I think we have to democratize data, and I can think of no better way than to provide this type of training